Hello, hello, and welcome to another edition of Ask Dr. Darwin. I'm Dr. Darwin Hayes, the new dentist coach, here to help all of my new dentists, all of the new dentists out there. My goal and my purpose is to help as many new dentists as possible. New dentists meaning pre-dental students, dental students, D1 through D4 years, recent grads, and even residents. I'm trying to help you with professional and personal development. I have a big network of other colleagues and a lot of information I like to share as far as tips and strategies to help you get what you want to get out of this profession in the business of dentistry. So today's episode, we're going to be talking with a current, I think he's D3 or D4 student, dental student, who's looking into applying into residencies. And this is the first time he's done it, of course. He wants to get some help, get some strategies as to some of the best programs to look at, what his options are, what things should he be doing as part of this process, so that he can get started on the right foot. So we're going to call him now and have him introduce himself and talk to him a little bit and help him get into a residency program. Let's see. Let's get him on here. Hey, student Dr. Harris, how you doing? It's Dr. Hayes.
Oh, how's it going?
Man, I'm so sorry. I'm glad we were able to finally get this call scheduled, but we've been trying to do the joint video thing for the last couple of minutes here, and it just wasn't working out. But nonetheless, we got you on the call, and we'll get your handle. So how you doing today, man?
I'm doing pretty well. How about yourself?
I'm doing good, man. I'm doing good. I'm going to have you show me how to work this Google Hangouts and the joint video conference call so we can both be on the screen at the same time. Maybe we'll do it for one of our follow-up calls later on.
Okay, yeah, sounds good.
So, hey, you reached out to me. You had a couple questions about residencies. What I would like for us to do is just briefly introduce yourself, and then state your question or concern, and then we'll go directly into the second part of the Q&A as far as the answer and some tips and strategies that I think may help you in your process. So go ahead.
Okay, well, name is Devon Harris. I'm a fourth-year dental student at UT Health Dentistry in San Antonio. Originally from Austin, Texas. I did my undergrad. I did 1 year at the University of Mary Hardin Baylor, played football there, and then transferred over to the University of Texas at San Antonio. Got my bachelor's in biology. And right now in my career, I'm at the point where I'm thinking about, doing some residencies. Initially, I thought about doing pediatrics, but now I'm kind of at the point where I want to, do general family practice. So I'd like to, be a part of like an AEGD or a GPR that will kind of help me expand my skills across like all the disciplines. And so I'm just trying to find, the program that will kind of fit me and what I'm looking for as far as like, what I'm trying to learn and things like that that'll kind of help me be a more well-rounded clinician.
Okay. Mm-hmm. So, previously interested in pedo, now you're kind of leaning more towards GP and basically looking for a program that's going to help you expand your skills and across all the different disciplines of dentistry, and looking for which program will help you do that. Correct?
Yes, sir.
Okay. Well, first I want to commend you for making the decision to do a residency. I actually think it should be. It should be mandatory. I think it should be part of your postdoc experience to do at least a 1 year residency, if not 2 years. There's actually a couple states now that make it a requirement for licensure to get us to practice in that state. That's New York, California. It's not mandatory, but it's optional. You can do a residency and get your license. Delaware is one of those states right now, and I think Ohio they have it optional. But looking into the future, it may be a requirement for more states that you do a residency, a postgrad or postdoctoral residency as a means of getting your license in replacement of maybe a board exam, a live patient board exam. So we'll see. But I definitely think you're right. You're on the right track in making that decision. But now you've got the other decision of, all right, which program am I going to be able to accomplish all of this? And unfortunately, man, there is no guide that kind of that you can use as a GPS to kind of help you navigate it. There's a lot of different information that's out there that's accessible with your fingertips on Google, but trying to locate where they are, we'll talk about that in a minute. But it can be a daunting task of trying to figure out what are some of the programs, where they are, strengths and weaknesses, and so much so that I'm actually working on a document, working on a guide right now for new dentists that's right in that same area, which is a guide to post-grad residencies for GPRs and AEGDs. So
okay, nice.
So a couple of things that I think will be helpful is what I think we should talk about. So number one, I understand you said you're from Austin, Texas originally?
Correct, sir.
Okay. So you're a Texas guy, been there for a little bit. What's your feeling on practicing dentistry outside of the state of Texas?
Ideally, I would like to stay in Texas. That's where, all my family and friends are, but I'm willing to go wherever, the best opportunity takes me. Right now I'm pretty much open.
Okay. All right. That's good to know. So that's good to know, just the fact that you're willing, you're open, but you also have somewhat of a preference to stay in Texas because that's where friends and family are. I know Texas is a big state. I lived in Houston for years, and I know how that can be. You want to be close to home and close to friends and family, so I got that. But it's good that you are open to opportunities outside of Texas. There's a lot of programs all throughout the country that you can go get your training, and then you can always come back to Texas. Texas is so big, it's not going anywhere. So that's good. So one of the first things I think that would be helpful for you is start to make a list. Make a list of programs, but programs based on what your preference is. And usually when I go through this exercise with other new dentists, I have them start making a list based on where they see themselves practicing. And, that is going to change, over the next 5 years, possibly. But, if you see yourself practicing in Florida, you may want to consider doing a residency there. Or you see yourself practicing in Houston, Houston, Texas, you might want to consider residencies in that area. So one of the first things that helps you do your research regarding different programs is actually making a decision as to where you kind of see yourself practicing. So if you see yourself practicing in Texas, you may want to do a residency that's close to home. Right now you're in San Antonio. I'm sure there's several programs associated with the school. There's several programs in Houston, several programs in Dallas. Where the three dental schools are in Houston. In Texas. So that would be a starting point. Making a list based on cities or states where you think you would want to be. So make a list. Any other places besides Texas? Where else could you see yourself practicing?
Well, I haven't really traveled a whole lot, so I can't really call that. But it seemed like it'd be nice to, maybe California, maybe like Atlanta. I've never actually been, up on the East Coast, like New York. I think that's where you are, right? Right. In New York, yeah, I've never been up there, but I'd really be willing to, take on new experiences. I don't really have it's not really set in stone. Right. And I haven't really put a lot of thought into actually practicing dentistry outside of Texas. I thought about, doing residencies and everything like that, but as far as, making my nest outside of Texas, I haven't really thought about that. But, if I have a good opportunity, I'm all for it.
Okay. Well, that sounds good because we have some residents in our program that, not from New York, actually from Georgia, went to school in Georgia. Another guy is from Charlotte, went to school at UNC, and both of them came to New York. New York is one of those types of cities where there's residencies and trainings, but there's also New York, and they've gotten there and said, well, you know what? Georgia's not going anywhere. North Carolina's not going anywhere. I have this opportunity. I'm going to stay up here in New York and see, what dentistry is like for me for a year or two, and then I can transition elsewhere. So that's good that you're open. As you're making that list, base that list also on places where you think may be cool to go and do a residency. So whether it's New York or if it's Philly or if it's Atlanta, California, there's lots of programs in Southern California and also Northern California. So maybe first step is use that as a guide so that you can have a foundation where you can start to develop and start to look at schools. So you said California, Atlanta, maybe New York or somewhere on the East Coast. So just with those three states or those three areas, there's a plethora of schools. So first step is what you've already kind of expressed. I haven't really thought about it, but if I am thinking about it, these are the places: California, Atlanta, New York, and of course Texas. Then I would tell you the second thing you probably would definitely want to do is you've got to get connected really, really fast to ASDA or to ADEA and do some research on those websites. So ASDA is the American Student Dental Association. Their website address is, I think it's asdanet.org. And also you can go to ADEA, which is the American Dental Education Association .org. Both of those locations or websites, they're going to have sections on the websites about not only dental schools, but also in your particular case, residencies, locations and programs after dental school. Also, another resource is through ADEA, they run what is called the postgraduate application service. It's called PASS, PASS, and they run PASS, which is the application service that most residencies will use.
I just made an account with them the other day.
There you go. Perfect. So as part of that, there's another link that's a part of PASS that also has a resource where you can go in and you can look at different programs that are in either California, Georgia, or Atlanta, or New York, whatever areas you've deemed where you want to be. Those are the areas that you can look under those three websites, those three organizations, and you can start looking at programs. So that would be the second step, the kind of research on those websites. And then
I started a little bit. Oh, go ahead.
No, go ahead. So how's that been so far?
So what I've been doing for the past couple of weeks is I've been kind of talking to some of the faculty at my school that I've known that have done AEGDs and GPRs.
Good.
It's like asking about good programs. And so I've started to hear about the programs in Texas, the AEGDs, and then the GPRs, and they have some at they have like a couple of BA programs that I hear are pretty good as well. So I've already started kind of building my list on the PASS website. And so as I'm talking to more and more people, I just keep adding more schools, as I hear about them. But my main thing is I just want to end up in a program where I can, as you said in one of your videos, know what I don't know, and kind of really just expand my skills and knowledge and not just get in a program where it ends up being like a fifth year of dental school. Cause I'm really interested in doing a lot of surgery, like implant surgery, and not just the surgery as well, but like perioperative management, and also, find a program where I can get involved with, pediatrics, molar endo, things like that, and even like something that has like external rotations, like in anesthesiology or internal medicine. Just something that'll, give me, while I didn't get a chance to get in dental school.
So that's good, man. That's good. So I would tell you, just based on what you just told me, the next thing, the next step was exactly what you've been doing. You've been asking faculty members, you've been asking students, and I would even ask recent grads that just graduated this, in 17. They're going to be a great resource for you. Okay, I know at some schools through ASDA, they may have like an ASDA day or half a day where all the D4s that have got it accepted into programs, they have like a seminar talking about their experience, their interviewing experience, what programs they apply to, whether it's a GPR, AEGD, or specialty programs. Some ASDA chapters will actually put together a toolkit, right? Toolkit of the different programs that all the people either interviewed at, and they may even have information, a toolkit where under each program they have maybe several bullet points about different things about the program, strengths, weaknesses, what they like, what they didn't like when they went to go visit. So if your school has that, awesome. If they don't have that, well, then you've got to do the work. Meaning, you've got to find maybe, I don't know if you can go to the dean's office, dean of academic affairs or student affairs. They should know where everybody's doing as far as the people that just graduated last week or a couple weeks ago, and see if there's a listing of where those students are going to residency. How many people are you typically in a dental school class at U Texas San Antonio?
We usually have about like 100 to 105.
Okay, 100 and 105. So probably, a little bit more than 50% are probably doing some kind of residency. I don't know what the statistics are at your particular school. But
it's about like 30-40%, I would say.
Okay. Well, there you go. That 30 and 40%, one of the things that's going to help you with your question and what you're trying to find is being able to tap into that list, that 30 or 40% that have decided to do a residency, that are going to do a residency, and find out which schools they're going to or which programs they're going to. And you may even be able to contact them directly. If they're starting residencies in July 1st, you probably got a good 2 weeks or 3 weeks before they are thoroughly immersed into their new educational endeavors. But you can always still contact them, I'm sure, after July 1st. But that's going to be, I think, for you, man, that's going to be the greatest resource because you're going to have immediate raw data. Everything that you find on the websites, information-wise, it's just missing something. And what it's missing is that human touch, that interaction, that one-on-one that you'll have with a recent grad who's interviewed not only the program that they're going to, but probably maybe 2 or 3 other programs. They can give you direct raw data that you can jot down and serve as a guide for you through this process. So step 3, you're on it, which is ask the different connections at the school, faculty, students, and recent grads. But you mentioned something I thought was very key and important. You mentioned you're looking for a program where you want to be able to do surgery, so maybe some implants, have some peds exposure, molar endo, and some external rotations, maybe anesthesia and internal medicine. If you're looking for something like that, then you're probably do best looking at a GPR program, a general practice residency, which is hospital-based. And that's the difference. The difference between a GPR program and an AEGD program is that the GPR programs are all hospital-based. So you're going to learn hospital-based dentistry, but you're also going to have mandatory rotations in anesthesiology. Usually it's for 2 weeks, all right, 80 hours of anesthesiology, and also mandatory by the Commission on Dental Accreditation for all accredited post-grad programs is family medicine or internal medicine. You have to have 80 hours of rotations in the family medicine or emergency medicine. So if you want those 2 things, those 2 areas, in addition to the other exposures, a GPR is going to give you that. So now you've kind of cut down your list of general dentistry residency programs, say from about 300 to maybe 150, just by making that decision. One of the things that is paramount in most GPR programs is that you will take call. You will have emergency call. Different programs have different call protocols, and that's something that you're going to have to kind of find out and as part of your research. But usually that's the program where you'll take call overnight. For a lot of dental students, they're like, oh my God, take a call. I've never done that before. It's a new experience, but it also allows you the outcome, the intended outcome of that is you're able to manage, you're able to manage dental emergencies in a hospital setting. Trauma cases that are shoulder or neck up, usually they call dental. Whether or not there's a joint, oral, maxillofacial, oral surgery department or not, usually first thing, anything neck up, they call us. They call dental. So facial lacerations, facial fractures, toothaches, of course, swellings, neck swellings, anything that's head and neck typically goes to dental. Some stuff may go to ENT here and there, but as far as suturing, lacerations, and fractures, they're calling us. So even if you don't see yourself going into surgery, even if you don't see yourself having a practice that's similar to that, having that skill set and being able to manage it, being able to know when you should refer and the reasons why, all those things you'll be able to differentiate and be able to utilize at some point in private practice, whether it's in your own private practice or you're in a hospital-based faculty practice or something similar to that. So also I wanted to add to that is keep in mind, it took you how long to go through dental school?
4 years.
So 4 years of learning. And of those 4 years, only 2 years was clinical, right?
Correct.
So even though you've had 4 years of training, 2 of which have been clinical based, unfortunately, man, it's not enough.
Right.
Even doing a residency for 1 year, guess what? It's still not enough.
Yeah, that's what I hear.
So even considering that, your 1 year residency is not going to be enough time to give you all the exposures that most of you and all your other classmates and people that have graduated, what they expect, what they want. It's just not enough time.
Right.
One thing that you have on your side, man, is that you're young. You're about, what, 25, 26?
26, yes, sir.
Man, you got lots of years left. Lots of years to participate in what we call in dentistry lifelong learning. So
Yes, sir.
I always try to temper or kind of curb your all the new dentist enthusiasm and wanting to learn all this stuff and be able to practice all this stuff in a short period of time. And like there's this certain sense of urgency. And I'm here to tell you, man, it's over the long haul. Think of it as a marathon race, not as a sprint, because stuff changes so much. And there's just not enough time in the day to learn everything. But doing a residency is going to jumpstart, kickstart, and allow you to have some momentum. So even after residency, you'll be very comfortable with learning new stuff and constantly having to learn new stuff throughout your career. So think of residency as, some people, shun the idea of thinking of it as a fifth year dental school. But really, it is and it isn't. It is in the sense that it's more learning. You're learning, you're perfecting your skills clinically, and you're learning new ways to treatment plan, to strengthen your treatment planning skills. You're getting more exposure, so you're increasing your repetition, your confidence, which is so very, very important. Your confidence, because patients see that. They can see whether or not you kind of lukewarm, hot, cold, you're in between, you're not sure. With time, you'll get that confidence, but you get that confidence by doing a residency. You get that confidence by doing, multiple extractions. What's the requirement at UT San Antonio for extractions to graduate?
For our junior year, I think, because we have like a oral surgery rotation, and it's about like 3.5 weeks long.
Okay.
And they just have like, I think there's like 2 like graded extractions that we're required to be evaluated on, but we can do as many as we want. Like I think for my rotation, I did like anywhere between like 15 to 20 extractions during that few weeks.
That's good. That's good. And you got, do you have some more rotation time coming up where you'll be able to do some more?
Yes, sir. Yeah, we'll have another. It'll be like an advanced oral surgery rotation. So I'll probably get to do a lot more.
So say you've done 20 already as a third year. Let's say you do 20, maybe 30 your second your D4 year. So that's like 50 extractions, right?
Yes, sir.
So follow me. So usually in a residency program, depending on the structure of the program, I'll give you our program for example. Most residents will do anywhere from 100 to 150 extractions, and that's usually over a 6 to 10 month period of time. So just right there, you're doing twice or 3 times as many extractions from 2 years of dental school. So with that exposure to repetition and treatment planning and risk assessment and going over people's medical histories and learning about which ones you're going to have to refer or how to section, how to do the surgical extraction, all those things you're going to learn in a shorter period of time, but you have so much more cases that you're working on, you start to become more confident about where your strengths are, where your weaknesses are. But it's just like anything else. It's like repetition. Just like when you were first in the labs and you were cutting that crown prep or you're cutting that class 2 prep. The first time it probably took you a long time versus where you're at right now.
Oh yeah, definitely.
So all that came from repetition and doing more. So your confidence level went up, and you were more certain. You had more certainty as to what you were doing. That's the reason why you do a residency, man. You increase your repetition on different procedures. You learn more things, and you're adding to your tool belt. So in that aspect, yeah, it's like dental school because it is still a learning environment. But at the same time, you also are now an employee of probably the hospital or the school where you're doing the training. So now here goes the whole introduction of the business side of dentistry as far as professionalism, and working as an employee that's providing oral health care to the community based from the hospital. So that's another thing that you learn by doing an AEGD or GPR. So that's where it's similar but yet different than being in dental school. So as long as my main point in mentioning that is keep in mind you've got time,
right?
And that you're not going to learn everything in residency. That's not what residency is for. But you will find some residencies are different in the sense that just because it says GPR doesn't mean that all GPRs are created equal.
Right.
You know, some GPR general practice residencies have more of an emergency and oral surgery base where as a resident, you're just handling emergencies, taking the teeth out. And that's great. That's a great residency if you're planning to go into oral surgery. But that may not be a good residency if you want to be a super GP or you just want to be a general practitioner where you're doing a little bit of everything, but you're more or less focused on comprehensive care. So if you're looking for more of comprehensive care, which it sounds like you are, then you've got to find those programs that give you more of a comprehensive care type of approach to training and also delivery from a residency standpoint. So again, it really goes back to doing your research, looking at those programs, and diving deeper into the websites that the programs that you're looking at. So you've got about 100. You probably got about 150, 200 GPR programs that you've got to sift through California, Atlanta, New York, and Texas. And then go on the websites. if they have websites, most programs should have websites at this day and age. If they don't, it's a flag, red flag on the field. Using a little football reference, flag on the field. But you have to go through those websites and dig deeper as to what the program is about, what the mission is, what are the goals of the residency training. That's what you need to be looking for when you search programs online. What are the goals of residency training? Where do residents get their experiences? What type of rotations? You start there on the websites. Then you kind of double down and look for former residents and current grads that are going to residencies, because they're going to have a little bit more information. All right. Now, another strategy that I really, really, really think you should do, especially for the programs that are in Texas. Now, I know Texas is a big state. You know, Texas. A lot of people from Texas think they are the United States of America. Everything's big in Texas. But especially with you being in Texas, one of the things that I recommend that you have an advantage is, especially there in San Antonio, there's going to be programs that you can just knock on the door and go visit. There's going to be programs in Dallas, which is it might be about 6 or 7 hours away. Also in Houston, which is about 3 hours away, I think, that you can go visit and see, because one of the things that you have right now is time before the application process starts. So I would want you to, programs that you may be interested that you can get to readily, I would want you to go visit the program.
Definitely.
And the reason why you're visiting the program is for two reasons. Two very, very important reasons. Number one, you want to see what the program is like. You want to see what the building smells like. You want to see what it looks like on the wall. Is it clean? You want to talk to the assistants. You want to talk to the residents. You want to talk to the program director if he or she is available. You want to talk to all the people that are involved in running the residency program and the dental care at those clinics. You want to see it, because when you look on the website, you can't see in 3D like you can in person on the website. So you want to be able to touch, smell, get a feel for the livelihood of the GPR. So that's one reason why you want to go. All right. The second reason is you want them to know that you're strongly, or that you have an interest in the program. All right. I always tell people, whatever programs you're strongly considering, or just even halfway considering, you got to go visit, because the people have to know who you are, because usually about 3 or 4 months later, we're going to get your application, and either we're going to make a connection with you or not. And one of the ways to make an immediate connection is the fact that, now we can put a face to the paper application, because student Dr. Harris came to visit 3 months ago. And I remember his name and I remember his face, and now I got his application. So so you want to go visit because you want to get out of obscurity. And you may have seen me talk about it before in a couple other videos, but the residency programs, we don't know who you are.
Right.
You're one of 150 people, tops, that's applying for anywhere from 2 to 20 positions at a residency program. We have no idea who you are, except for your paper application. But one of the things that you can circumvent and jumpstart your candidacy is by going to visit. Now, I've seen your face. I've met you in person. Now I see that there's a real live person behind this paper application. That makes sense?
Yes, sir.
And it seems like a silly strategy and an easy strategy, but it's so easy that people don't even do it.
Right.
People do not do it. I don't have the time. I don't have the money. I don't want people at the residency to think that I'm too pushy, man, please look. It's all fair game. Like I told somebody else the other day, it's fair game because it's not only for them, but it's really for you because you want to find out if this is the place you want to be for the next 12 months, 365 days.
Oh yeah, you got to be hungry.
You got to be hungry, but you also have to. You have to go through the process and you seeing yourself at these locations and these places where you're going to be spending your time. I mean, it's like dental school. It's time consuming. It's just on a different level, but you're going to be there 365 days. Can I and do I see myself in this environment? And you don't know until you go visit, or you'll have a better idea when you go visit because you can't make that determination just off the website. So I would go visit the programs for those two reasons. Have you had a chance to do any of that yet?
I've been able to visit the AEGD program here in San Antonio, and I've been able to make some really good connections with the faculty and the residents as well. And so I've been kind of talking to them throughout this whole year, and just kind of picking their brains about the program and strengths and weaknesses, and what they wish they would have done coming out of dental school. So, but I actually have about like 3 weeks between now and when we start school, and I actually planned on going to a lot of the residencies and visiting, just to kind of get a feel for it. See, and I even wanted to come out to your program at some point and get a feel for it, because I was reading on the website, all the disciplines that you guys covered. It seemed like it was, right up my alley. So I definitely want to explore more.
Yeah, man, you should. You should. And one thing that's unique about New York, I would say probably 50%, it seems like it, but maybe not 50%, but probably about close to 20 or 30% of all the residencies, GPR residencies that are in the country are in the New York, New Jersey, Connecticut area. So, I mean, just in the Bronx alone, man, we've got about 5, 6, 7 programs. So, for strategically speaking, when you go visit, if you can commingle and co-visit programs in a particular area, I think you'll do yourself justice in a sense that it helps you through this whole process of seeing what you like, and at the same time getting the residencies to see you. That's the reason why you visit programs, to see what you like. You see yourself there, and then also so you get exposure to the residency, so they see you, so that when your application comes in 2 or 3 months, they can immediately put your face, and when they saw you, to your name, or a name to the face, vice versa, because now that's going to allow you, your candidacy, your application, to maybe pop out of the pile of the other 100 people. Because you got to remember, for most of these programs, they're only taking, they're probably only taking less than 5% of the people that apply. Less than 5%. So how are you going to be, how do you put yourself in that 5% category? And one of the ways you do that is you go visit. The time between your D3 and D4 year, where you have a little clinic break. I know some schools have a little clinic break, some don't. But if you got a clinic break and you can get away for us in Maryland, we had a month off. During that month, if you can go visit programs, boom, go. Because that'll be your opportunity to get out of obscurity with the programs, but also your opportunity for you to see and learn more about the program that you can't see on the website. So, main reason why you go visit the programs. And quick tip, when you go visit the programs, make sure you have your own business cards, your student Dr. Devon Harris business cards, but also you want to have your cards so that you can exchange with people that you meet, whether it's residents, the residency coordinator, the directors, whoever's in charge of running the program. You want to be able to exchange and get their card. Actually, you really want, it's not even about them getting your card. You really want their card. And you want their card so that you can follow up with them. Follow up. Thanks for the tour. Thanks for the time. Really interested in ABC residency. I will be applying, yada, 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 yada. And if you have any other questions, you can, in another follow-up email or something, express your interest or express your question. Great opportunity to do that, because what that does, again, is now the residency, people at the residency have your name on the tip of their tongue before your application even gets there, man. So that's a strategy. So that's why you want to get people's business cards and follow up. An email, a phone call. Some people will be worried about, I don't want to call them and bother them, or they're going to look negatively on me. My approach, my response to that is, hey, my goal is to get into a residency. I need the residency that I'm interested in to know that I'm strongly interested and I want to be selected for an interview. Because that's your next step, to get the interview.
Right.
Typically, you can't get into a program without you having an interview or something similar to that. Okay, so that's the reason that you are going to visit, also so that you can, once they have your application, you can get an interview. So what you're doing now is great. Everything that you're doing through AEGD programs. How many programs does UT San Antonio have? I know they probably have both.
They have the AEGD, and then there's like a GPR at the VA hospital that's like right across the street. And I plan on going to visit that program as well within the next week.
Good. Now I would tell you, you probably need to go to Houston, and you need to see what's at UT Houston. All right, a lot of VAs there. There's probably AEGD programs. Actually, there's an AEGD program and a GPR program at Houston. I do know.
Yeah.
Dallas,
I have them both on my list currently.
Yep, Dallas. At your old school, Baylor, Texas A&M, Baylor. There's probably both there also. School-based program, AEGD, and then probably a couple hospital programs in the area. So that's good. I would tell you, even somewhere close around Texas is Louisiana, LSU. LSU has a great GPR program and AEGD program. I know the former residency director for the AEGD at LSU, Dr. Oh God, of course I'm going to forget his name when I see his face. Right now, I can't think of his name, but I have that contact for you. And I know a former resident, Dr. David Carter, who graduated finished the program maybe 2 years ago and has just opened up a new practice. So those would be two.
Oh yeah, I met him at the conference last year. Yeah.
There you go. There you go. So
yeah.
Right then and there, you said something important: connections, meeting people, networking. All right, that's another strategy and tip. Are you going to the NDA, SNDA conference this year?
Yes, sir. I'll be there.
Awesome. There's going to be an actual session and a seminar on how to get into residency programs directly from program directors' perspectives. We have a rep from GPRAEGDs. We have somebody from ortho, and we also have someone from pedo. Those two specialties are typically the most, probably the top three that are, two of the top three that are most popular. So you'll get some tips and strategies about, what program directors are looking for and how you can enhance your candidacy in applying to those programs. So that's one reason to go to the meeting, but also you'll have the opportunity to meet other students, D3, D4 students across the country that are in the same position that you're in right now, which is looking at programs. And some of them have already made their decisions. They know whether or not they're specializing. They know whether or not they're applying to AGD or GPR programs. You need to connect with them and share some stories. Find out, where they applying, where they visited. Because that's a great source of information to piggyback on what you're already doing locally. But they're going to give you perspectives on other programs. I know a program in Atlanta. A couple students are going to or want to go to. So, but things like that, you'll be able to find out and get some information from them too. So networking networking,
Oh yeah.
both locally, which you're doing now, but also outside the big state of Texas.
Mm-hmm.
Everybody's coming to Dallas, so you got an advantage. So you got to definitely be on your ready to go mentality when people come into Dallas, and you just start networking, man. You start networking.
Oh yeah. Yeah, the last conference in Atlanta was really valuable. I made a lot of connections with students and with dentists as well. And I've actually kept in contact with them. And even the ones that are, trying to look at residencies, like we've been exchanging information. Like I've been students that are looking at coming to, our program and, getting them connected and, vice versa. So it's definitely been valuable.
There you go.
And, I met Dr. Carter as well and got his contact information. So I'll definitely be in talks with him soon about the program at LSU because I actually didn't even think about Louisiana, but now that you mentioned it, that would also probably be a good fit for me.
Yeah, man, Louisiana, Atlanta. I think there's one in Oklahoma. I had a candidate decide she's going to go to Oklahoma. There's I think at the school there may be a GPR or AEGD program. I mean, they're all over the place, man. I mean, they're all over the place. But, so, and that's one of the challenges. And I just don't know why there's never been a guide. Just like they put together somewhat of a guide for dental schools, but it's a big task. But you know what? We're gonna get it done. Actually, we have started to get it done. The main thing is just really depending on the feedback and the level of cooperation from all the different GPR and AEGD programs. But I'm glad you reached out to me with regards to asking that question because, I get exposed to candidates, every year that are applying to, more than just my program. So I get to hear some stories about their visit and about their interviews at different places. And in addition to being involved with organized dentistry through the ADA and also through the ADEA, I get to meet people that run programs across the country. So good level of being able to network and pass on and share that information. So I think you got your marching orders. Some of the stuff you're already started to march on, as far as making a list of areas where you think you might want to practice out, both including Houston and other states, other cities. Visiting those programs, visiting those cities to see if that's a city that you may want to be at for residency or beyond. Researching, doing your research on the information that's available out there currently on the internet through ASDA and through ADEA and through the ADA, the PASS process. Also asking and making inquiries from those connections at your school. There's some faculty that have done residencies maybe 10, 20 years ago. Some of the residencies have changed. Some are not existent anymore. But still, you want to start that process of asking and getting into your database, or I call it your power base, or people that you know that may know directly about the program, or they may have a colleague that may have gone to a specific program. You just want to inquire. And also those recent grads too. And then next, visit the programs, which we talked about, and the value of visiting the programs, and then just continuing to network outside of Houston, outside of Texas, which you did last year when you went to the National Convention in Atlanta. You met a lot of students, and then also this year in Dallas, you're going to be meeting a lot of people and networking with people who are in the same shoes as you, which is getting ready and preparing for residency. Trying to think what other questions you have, man.
I wanted to ask a couple questions specifically about your program, because I noticed that I think you guys said that you guys take about like 28 to 32 residents or something like that. Is that correct?
Yeah. You know what? Let's do this. Let's do a separate call when you and I kind of talk about Bronx, Lebanon more specifically, and I think that'll be a good way to kind of segue and get that answer. So what I'll do is I'll call you back and we'll do another call just based on a specific program.
Okay, sounds good.
All right, so I'll call you back in a little bit.
All right, and thanks so much for your time. I really appreciate it.
You're welcome. Did you have any other questions about how you should go about this process, some things you were thinking about, some questions you might have had, yays or nays about what you've heard others do and what you think you should do?
I think we pretty much covered, my general questions. I feel like I got a good handle on, how I should go about it now. You did was definitely very helpful.
Good. Good.
And so I'll just continue to network. Like, that's one thing I'm good at is networking. So I'll just continue to do that.
There you go.
Just continue to pick people's brains and just until I find the right fit for me.
Yep. And as you're picking people's brains, which I know you already do, it's almost like studying those playbooks when you were playing football, man. Different plays. I don't know. Did you play offense or defense?
Defense. Yeah.
Defense. So, different defensive strategies. What happens on the offense side if the running back is coming out of the pocket and he's going left or right, all that different stuff. I was a track runner in college and played soccer too in high schools, but I had a lot of friends that were football players that played in NFL. And that's one of the things they always said was, having the information is good, but if you don't study it and then if you can't apply it, then it means nothing. So all these people that you're talking to and picking people's brains, keep doing it, but then go the extra step and being able to actually apply it to what you're attempting to do. So, but man, just talking to you, man, you on the right track. You on the right track. So that's good. So good, man. So we'll keep in touch as it relates to your process, and I'll see you in Dallas this year. And then if you have any other questions after Dallas or what have you, you're more than welcome to give me a call or send me an email through newdentistcoach@gmail.com. I think we connected on Facebook, right? Was it Facebook?
Yeah, yes, sir. Mm-hmm.
And I think I added you to the Facebook page, New Dentist Development Network. We got about 400 people, well, just over 300 people that are part of that network, both new dentists, dental students, recent grads, residents, and people that have been practicing anywhere from less than 5 years to over 25 years that are adding content to that page to help you all as new dentists. So that'll be another resource for this process too. But I thank you, man. I'm so glad we connected and reached out, and looking forward to meeting you in person and following your progress.
Oh yeah, definitely. I really appreciate it.
You're welcome, man. Just spread the word. Let other people know that if they have some questions or have some areas of some uncertainty as it relates to this topic, just have them reach out to me on email and or through the network, the New Dentist Development Network on Facebook.
Okay, well.
All right, man. I'll talk to you soon.
Okay, sounds good.
Okay, bye-bye.
All right, thank you. Bye.
All right. Another coaching call done. Another success story. This guy is on his way, man. He's going to make it happen. He's probably going to get into he's probably going to like about 4 or 5 different programs, and then he's going to have to match them and rank them. But that's a whole nother process we'll talk about. The main thing right now is finding programs that he likes, applying to them, and getting the interview. And we have a whole nother segment on the interview day and what you should be doing, what questions you should be asking, and how you conduct yourself through the interview. This has been the New Dentist Coach on Ask Dr. Darwin Show. Thanks again for joining us. See you next time right here. Questions right there. But one-on-one and answering your questions right here. You ask the questions and we get the answers for you. Take care.